50 years of vertigo treatment, 10 years in otolaryngology and 40 years in internal medicine treatment of vertigo, especially in middle-aged and elderly people, and treatment of Meniere's disease. Morihito Nakayama, MD Department of Internal Medicine. Nukada Memorial Hospital, Kamakura City, Kanagawa Prefecture, Japan. Keywords: vertigo, benign paroxysmal positional vertigo, Meniere's disease. My background and current practice. After graduating from Gunma University School of Medicine in 1971, I entered the Graduate School of Otorhinolaryngology and graduated in 1975. After 3 years' experience in the Department of Otorhinolaryngology at the Musashino Red Cross Hospital, I moved to the Department of General Medicine at the same hospital in 1980, hoping to be able to treat the whole body. I was then transferred to Yokosuka Kyosai Hospital, where I worked in the Division of Respiratory Medicine. There, I wore 2 hats and I started a vertigo outpatient clinic alone in the internal medicine department. As vertigo is a very diverse symptom, my clinical experience of working in 2 different departments, rather than just in ENT or internal medicine, has enabled me to diagnose vertigo from a broad and multifaceted perspective. I will be discussing vertigo in a series of case studies, but first I would like to give you an overview of my approach to vertigo and its treatment. Introduction. By 2025, all baby boomers will have entered the later stages of life over 75 years old, and the number of older people will increase significantly. In this social environment, elderly people, including middle-aged people with risk factors such as diabetes, hypertension, dyslipidemia, visceral obesity, atrial fibrillation, and smoking, are in a medical environment where they are prone to dangerous dizziness and central vertigo, vertigo caused by the brain, against a background of arteriosclerosis. However, in spite of the fact that there are many other vertigo diseases, the conventional medical treatment in otorhinolaryngology as well as in internal medicine is mainly focused on the inner ear at present, with benign paroxysmal positional vertigo, Meniere's disease, and vestibular neuritis being the most common types of vertigo. There is therefore a great danger that dizziness at risk and central vertigo, vertigo from the brain, may be overlooked in this inner ear-centered approach. In our vertigo outpatient clinic, elderly patients, patients with suspected cerebral vertigo and patients with the above risk factors are referred to the nearest general hospital for MRI of the head, including diffusion-weighted images to detect fresh infarcts and the latest magnetic susceptibility-weighted images to detect microbleeds, MRI of the head and neck. Benign paroxysmal positional vertigo. The theory that benign paroxysmal positional vertigo is caused by otolith migration in the inner ear is now the dominant theory in the world. However, I believe that poor blood circulation to the brain due to stiff necks and shoulders is far more common. This is because there is a rapid increase in the number of stiff necks and shoulders caused by cervical osteoarthritis, cervical spondylosis, in the elderly, and straight necks and kyphosis. Cervical lordosis is normal in the young and middle-aged due to the slouching posture caused by smartphones and computers. Traditional Japanese medicine has long known that stiffness in the neck and shoulders can contribute to vertigo. However, the relationship between vertigo and stiff necks and shoulders has been completely ignored in the West. Though, I was encouraged to find out that there is an ENT, ear, nose, and throat doctor in the USA who agrees with me. That is, vertigo due to the neck, cervical vertigo, can induce the same nystagmus, abnormal eye movements, as benign paroxysmal positional vertigo. I have published 4 books on vertigo, and in 2016 I appeared on the NHKE television program called Choice, commenting on the close relationship between the neck and vertigo. Probably this is why some doctors are gradually recognizing that the neck is one of the most important factors in causing vertigo. Meniere's disease, especially the treatment. Meniere's disease is quite difficult to treat with conventional therapies, but we are able to treat it using anti-herpes virus medicines, which are not yet widely available in the world. In some cases the vertigo and its associated symptoms disappear dramatically and completely. At the moment, we have 147/168 cases of vertigo, an elimination rate of 88%. Aminame ver, famciclovir, valaciclovir hydrochloride, aciclovir. Persistent dizziness. In recent years, there has been an increase in the number of cases of floating dizziness, which can be described as a fluffy, wobbly feeling, lightheadedness, or giddiness, especially in the elderly. I would like to explain the causes, differentiation, and treatment of this condition during outpatient consultations. The causes, differentiation, and treatment of this condition will be explained together with examples, and we will also discuss this during your outpatient visit.